Now we move on to Paul Moulton of Isle of Man Television. Good afternoon, Paul. Faster Mai.
Good afternoon. Dr. Ewart, you weren't here at the last press conference, and I asked a question that I did want to hear it from you yourself. Are you fully on board with these decisions being made by Komen? As, don't forget, obviously, and everyone is aware that you are putting in the medical information to this. Are you completely 100% comfortable with the way we're going?
I don't make the decisions, so it's not my role to either support or oppose the decisions properly taken by Komen. As you said yourself just then, my role is to make sure they're apprised of all the current evidence and intelligence and data on COVID, and then they take that into account. They also have to balance the wider economic and social impacts. So long as the decision is properly taken by due process, I will work with that as a public servant.
My question was, are you 100% on side, therefore, with what is going on? Because your input is valuable to everyone to hear what you think, not what Komen think. What do you think? Are you on side?
This is a very difficult time to be making decisions, and there are pros and cons to both sides of the argument, as we've seen played out in the press across and also in discussion here. There is no right or wrong. None of us has a crystal ball. We can only feel our way based on the information we have and responding as things play out. So to that extent, it's a properly taken decision, and I work with that as a public servant.
Oh, you're comfortable with the decisions being made, are you?
The decisions have been made in accordance with due process, as is perfectly right and proper, and as a public servant I support and I will support in the delivery of those policies.
My next question, basically what we're missing from this briefing today was the word herding, and this has been going on since we started these press briefings. Herd immunity, is this now particularly what we are doing, albeit but you're not actually saying it by name now? And I don't know who wants to take that one.
No, it's certainly not, Paul, but I'll let the Health Minister expand on that.
Yeah, I'll bring the Director of Public Health in a moment, but I'll express my personal views, and these are just my personal views, Paul, so I'd want to get that on the record first. Most certainly not. We have never gone down the route of herd immunity. I think in the early days of the pandemic, I think I stood at one of these podiums. It was in a different room then. It was when we had the old wooden podium, I think, and I actually made clear that I didn't think herd immunity was a route to go down because it's a wonderful scientific theory, but there's continuous debates about what level do you have to get to actually achieve it. And as far as I'm aware, I don't think in practice it's ever actually been properly assessed and achieved before. It's a great scientific theory, but it's not something government should be attaining to. We most certainly are not attaining to that. I know it's been the talk of social media, and there's a lot of anxious people out there with the case numbers, and that's actually very, very understandable because it's very different to the approach the island's taken previously. But as we come to live with COVID, and it is a sad fact that it's not going anywhere. It does have to shift to around hospitalisation. And the Chief Minister laid out something very important before that is very different to the approach being taken in the UK, although they are changing the approach a bit now. Previously, it's been said with the UK it is only ever a one-way street. They previously said that this was a one-way roadmap, no going back. We've never said that. And we've deliberately never said that because we still have measures in place around hospitalisation, around pressures on the health service. And if we actually see that, then we may have to consider other measures. So we haven't said it's a one-way street. What we've done is shift our focus to treat COVID like we do a lot of other diseases, where it's the outcomes that matter and whether the health service is actually under pressure or not.
And Dr. Hewitt, do you want to add to that? Sorry.
Oh, sorry, and yes, I'll bring Dr. Ewart in.
Thank you. Yes, little to add to that really, other than to say that our chief defence against COVID is not trying to achieve herd immunity, it's vaccination programme, and then supporting that with all the actions that we can take around hand space, fresh air, and making sure we report symptoms and get tested. Those are the tools in our toolbox, if you like, for COVID.
It may be said you're doing it inadvertently then, because that's exactly what is happening. People are catching this and getting over it and not going to hospital necessarily, but those people will have the antibodies, therefore herd immunity will potentially be reached.
But it doesn't last forever, Paul, does it? Herd immunity, if you have, I've had COVID, you only have the antibodies in your body for a matter of months. So, herd immunity would be if you had it for the rest of your life. you can catch it again.
And the vaccines don't last forever because we're talking about boosters already. So, it's the same thing.
We need to be careful with the vaccines. We don't actually know. The scientific studies still going on around that. The booster programme is a precaution because the recent studies have shown that if you get a booster delivered 6 months after you've had your second dose, then it actually increases the actual level. So we don't actually know around the vaccines at the moment how long any antibody reaction lasts. But certainly, as the Chief Minister's just said, again, one of the reasons I think I've stated before at this podium that personally I've never favoured the herd immunity idea is, to me, herd immunity only works if it's a permanent barrier against infection. And we know with COVID it certainly isn't. One of my friends in the UK has had COVID 4 times now since the pandemic started. So they've tested positive and they know it's been separate infections. So it's certainly, I've never seen herd immunity as a starter, really.